This is Hayes Holder from Channel 2 MDCC News. And today, first I'm going to switch it over to Nikhil and Kanisha so they can talk to you about the correlation with mental health and COVID-19. Over to you, Nikhil.
Thank you, Nurse Holder. Hi, this is Nikhil Jones, student nurse with MDC Channel 2 News, and I am reporting live on the hot topic that's dealing with mental health during COVID-19. Mental health is a person's condition with regards to their psychological and emotional well-being. And with the presence of COVID-19, it has affected many people's lives and have placed great strain on a person's mood, thinking, and behavior. The people have experienced isolation in nursing homes and hospital settings as well. And it has led many individuals into mental illness and requiring them to seek help. So MDCC Channel 2 News decided to reach out to a local growing mental health facility and gather information on the increase in mental illness. I had the pleasure of speaking with the head director of Life Health Facility. Life Health is a mental health facility that is located in several cities in Mississippi, and the facility provides assistance for those suffering from mental health. And I was quite alarmed at how COVID-19 has drastically affected different individuals. The director states sales on alcohol has increased drastically, and that he fears that many individuals that have been doing well will probably end up relapsing and see more addiction in the days ahead. Even according to the CDC, certain groups including ages 18 to 24, minority, non-Hispanic Black respondents, self-reported unpaid caregivers for adults, and essential workers have all thought of committing suicide during a 30-day survey conducted by the CDC. Life Health Director has stated that people seeking assistance from its facility has not only been seeking help for suicide, but for alcohol dependence, depression, drug abuse, grief, and changes due to work and school closures. He states that there has not also been only one particular age group, but that the ages have ranged from adolescents to the older group. And he states that to be true because we have to remember that our children and adolescents have had their schools and social schedules change. Young adults starting their careers are now left with job uncertainties due to job closures, whereas established adults are left with economic hardship and fear of becoming ill from the COVID-19 and also of their parents possibly becoming ill. And with the information provided by the director, it shows that it has been a great increase in mental illness. The director of Life Health also provided information on therapies that are offered to help aid in decreasing mental illness and help for those that have developed mental illness due to the COVID. Our fellow anchor, Kanisha Johnson, will share those services, but before I hand it over to you, Kanisha, I would like to provide Life Health hotline number. And the number is 1-866-453-6216. Again, 1-866-453-6216. And it is a 24/7 hotline that you may call. Now to the news anchor, Kanisha. Thank you.
Reporting live from the studio on a very hot topic that's trending in today's news. Hello, everyone. I'm Tanisha Johnson, and I'm here to report on the increasing numbers in mental health issues and interventions as it relates to COVID-19. I spoke with a director of one of the local facilities here in Greenville and received vital information on this hot topic. He states There has been a large number of patients admitted to the facility for mental illness as well as substance abuse related to the pandemic. The facility and staff members utilizes a wide variety of programs and interventions to assist these patients. These programs are tailored to meet each individual's needs. The facility offers inpatient and outpatient treatment depending on the severity of the problem. Each patient is screened and treatment is provided accordingly for these patients. This facility treats all age groups, but lately more younger adolescents has been admitted for treatment. Treatment can last 30 days to 5 months or longer. There are trained psychiatrists and psychiatric nurse practitioners available for these patients. Treatable conditions may include adjustment disorders, depressive disorders, anxiety, grief, schizophrenia, bipolar, personality disorders, and many more. There is also a hotline number available to dispatch a therapist to someone with any of the following: suicidal thoughts, homicidal thoughts, psychosis, and any other severe symptoms that may require intervention. That number is 1-866 453 6216. I repeat, 1-866 453 6216. This number can be utilized 24 hours, 7 days a week, with a master level therapist available at all times. So remember, you guys, it is okay to seek help. And I know it may be difficult to accept that there may be a problem, but acknowledging that there is a problem is the first step. Whether it be for you, a friend, or a family member, seek help and let's stop the stigma of mental illness. Now back to you, Hayes.
Thank you very much, Miss Kenesha, for that elaborate information. Now, I'm going to switch it over to Miss Miranda Toten so she can talk to you about fall precautions. Miranda, over to you.
Hey everyone, my name's Miranda Toten. I am an MDCC student nurse in the ADN program, and I am wanting to speak to you all about precautions that we all need to take during the fall, especially with COVID going around, just to prevent the germs and all that. First of all, I want to talk about vaccinations. With the fall coming, the flu season is getting near us, and we need to get a flu vaccination. The flu can affect anyone, even the fit and healthy, so it's very important to get your annual flu shot. And also, when you get the flu shot, you're vaccinating yourself, but you're also protecting the ones who are unable to get their vaccination every year. So if enough people are vaccinated, they can help protect everyone unable to get vaccinated, as those who are immune compromised or young infants under the age of 6 months. Another topic I want to talk about is hand hygiene. It is, you would think that washing your hands would be something common that a lot of people do, but of course that is not. So it's always important to wash your hands, but I know since COVID has came along, a lot of more people have been washing their hands, making sure that they're staying clean and all that. But it's always good to wash your hands for a minimum of 20 seconds. Make sure, some people say they're ABCs, sing happy birthday, just whichever one you prefer, but just make sure you clean your hands very well. Another thing is you need to get plenty of rest. Not getting enough sleep as well as poor quality of sleep can affect your immune system. So it's always proper to get 6 to 8 hours of sleep, or whatever your body is requiring for you to have, because we don't want that to affect your immune system. It's always good to drink lots of water as well. You need to stay hydrated because it flushes out the toxins and keeps the mucus in your respiratory tract thin. If you have a cold, mucus increases to fight the infection, and keeping the mucus thin can make it easier to be expelled when your body is coughing or have a runny nose. Proper nutrition is another precaution that we need to take in the fall, just to make sure that our bodies stay healthy. Eating healthy and having a balanced diet, which is rich in whole foods, fresh fruits and vegetables, nuts and seeds, is very important for a healthy immune system. A large part of your immune system is in your digestive tract, therefore it's essential to keep your intestinal lining healthy and functioning. Regular exercise is also a good component to staying healthy in the fall. Just regular gentle exercises, maybe 30 minutes a day, or not even a day, maybe 3 to 5 days a week, whichever you prefer. And then spend some time outdoors. Being cooped up inside heated buildings, recirculated air in the winter can help viruses spread. So always, if you work a lot inside, go outside on your lunch break. Get a breath of fresh air. Vitamin D. Everybody needs vitamin D. And make sure, this is a huge thing, make sure that you can manage your stress. A lot of people do not understand that stress can affect your body. I mean, it affects you mentally, but it also can affect you in a physical way. It decreases your immune system. You are more susceptible in getting cold, flus, anything like that. So always try to manage your stress. You always want to avoid stimulants. You can strengthen your immune system by avoiding stimulants such as energy drinks, excessive caffeine, nicotine. Smoking depresses your immune system as well. So if you smoke, it's always best to quit. And another thing that I would like to talk to you all about is pneumonia vaccines. I know that they are normally not required unless you are immune compromised or you are 65 or older. But if you are able and eligible to get those vaccines, make sure that you get those vaccines. And altogether, I just want to let y'all know, with flu season coming along and with us having COVID, I know that we are all trying to get in better habits of, just healthy habits altogether. Disinfecting touched areas, at home, school, work, getting proper sleep, physical activity, all this stuff that I've already talked about. Drinking plenty of water, stay hydrated, stress management, eat good foods, and like I said before, diets containing more fruits and vegetables, because especially with COVID and the flu as well, you need to make sure that you get those proper vitamins, such as zinc, B6, and magnesium. They also help boost the immune system, especially during this pandemic and the flu season. I just wanted to talk to you all about those certain precautions that we can take during this time. I know it's hectic. Hopefully I've given you some good tips that you can take up on, and but just remember, flu season is coming. We need to take precautions. Continue to wear your mask if you're out and about. If you're immune compromised and you have someone else who can go to the grocery store and all that for you, just have them do that. But the main thing is keep your hands washed. Still stay away from people who are sick or 6 feet apart. What the CDC is recommending. Thank you.
Thank you, Miss Miranda, for that thorough explanation on the precautions that we need to take for this crazy pandemic. Now, I'm going to switch it over to Mr. Carlos and Miss Jelena so they could talk about sports during this crazy pandemic. Over to you, Carlos.
Thanks for that, Holder. 1.5 million men participate in football each year. 1.12 million suffering injury. 1.6 million men participate in basketball each year, and 1.2 million of those suffering injury. In athletes today, the most common injuries are hamstring and ACL tears. When athletes return back to playing sports after the COVID spike, trainers suggested that they ease back into training and playing because they had been out for so long. And their body needs to get acclimated to playing again. Not only have COVID affected sports in a physical way, but also in a mental way for athletes and also fans. Athletes and fans, sometimes the sports are an outlet for them. And being that they can't play or can't come and support the team that they go for, that can cause a great bit of anxiety and depression. Since the spike of the pandemic, there has been a rise in the number of student athletes injury, including stress fractures and ligament tears. But for professional athletes, the break from traditional training has created time for the athletes to focus more on strength and conditioning. It is said that strength and conditioning is the most common and best way to reduce the risk for injury. For professional sports, when they have an injury, the price method is used to sustain the injury. The price stands for protection, rest, ice, compression, and elevate. Ways to reduce injury. Ways to reduce injuries and coming in contact with COVID will be, of course, washing your hands, social distancing, wearing your mask, taking daily vitamins such as calcium and vitamin D, multivitamins, and eating fruits and vegetables, exercising, and doing things to eliminate stress.
Whether you're an athlete, fan, or future industry leader, you will probably be left to wonder what COVID means to future sports. COVID has affected sports significantly with cancellations, delays, and cutbacks happening every day, which will cost the leagues billions of dollars. For example, NCAA makes almost $1 billion annually from media right deals. Many seasons are cut short, and due to the decreased amount of time played, some players are forced to pay a penalty to the media. Also, a number of players has been diagnosed with COVID and are placed on immediate isolation for 10 days. During these 10 days of isolation, they are not to come in contact with team players, faculty, or team personnel, leaving them to have lack of access to exercise and physical activity, which can have a mental impact and compound stress, anxiety, and depression. Sports are not only a fun thing, they are sometimes the only thing someone has with that information. You can tell why some players are affected mentally because playing is their only way to cope with stress, maybe their only way of relaxation. If organizations are not able to keep safety measures in place during competition, for example, keeping participants 6 feet apart at all times, they may consider limiting participation to within team competition only. For example, scrimmages between members of the same team or team-based players only. Fans are also affected in a way in which they have become virtual fans, which can have a negative and positive effect. Some positive effect is that fans are displayed worldwide in Disney's arena. COVID-19 pandemic has had and will continue to have very considerable effects on the sporting world as well as on the mental and physical well-being of people around the world. So now sports industry along with the fans must endure the temporary loss.
Thank you, Miss Jelena. Now I hope that everybody will use these precautions and these safeguards so that we can all stay safe. Remember to wash your hands, stay socially distanced, and be safe during this crazy pandemic so that we can prevent the spread, we can get back to normality. Thank you, and have a good day. Signing off.